Good afternoon, everyone. We are live today at Sakra World Hospital, Bangalore. We have with us our expert Dr. Arjun Satapute, a consultant respiratory medicine to discuss all your queries on asthma. Good afternoon, doctor.
Good afternoon.
Welcome to our live show.
Thank you. Thank you.
Doctor, here are a few questions from our viewers on asthma. Let's go for questions, sir.
Okay.
What is asthma caused by?
See, asthma is a chronic inflammatory disease of the airways. So, usually in susceptible individuals, like those who have family history of asthma in your parent or sibling, those who have some allergic nature already, like this eczema, allergic rhinitis, or some kind of early childhood things like those who are born in the prematurity, low birth weight, and in such susceptible individuals, if there is some kind of exposure in the form of indoor air pollution, like this house dust mite, simple house dust, or pet dander, or with the outdoor air pollution like smoke, fumes, and gas, such people are more predisposed and can lead to having asthma in their life. So this is the way anybody who's susceptible after exposure to certain kind of triggers can develop asthma.
Okay, sir. The next question is what are the common symptoms of asthma?
So any patients who has asthma will have this 3 to 4 main symptoms of episodic cough, wheezing, breathing difficulty, and chest tightness. So these are the symptoms we usually across of the majority of patients of asthma. But there is some entity called as a cough variant asthma, where the predominant symptom is usually only cough, and it usually doesn't settle unless the patient takes the proper medication for asthma.
Okay, sir.
Yeah.
Can asthma be treated?
Yes, it can be treated. Over the period, I will elaborate what is the treatment and what all we give. Yeah.
How to relieve asthma?
So see, like in detail, I will tell you about what all medications available for asthma. So in general, two main medicines which we give for treatment of asthma. One is a reliever medications which take care of the acute attacks of asthma, which are usually short-acting beta agonists, which come in the form of either tablets, inhalers like a metered-dose inhaler or dry powder inhaler, or nebulization. And other is a controller medications which also come in the form of either inhalers, which are usually metered-dose inhaler or dry powder inhaler, nebulizations. So you can see in the YouTube or Google it, what about this, what are the metered-dose inhalers or dry powder inhalers. So these are the few ways how the asthma is usually relieved. Over the period of time, as the Hemati asked me questions, I'll exactly tell you what are the medications to be given precisely for the treatment of asthma.
Okay, sir.
Yeah.
Is asthma born or made?
See, asthma is neither born nor it's made, but it's like a bit a gray area. So what I can say is, assume a woman gives a child, gives a birth, and she already has a asthma. Such children born to such mothers are at more chances of developing asthma, and it is there is no hard and fast rule that it can happen only in the childhood, but such patients in the early age, young age also, after exposure to certain kind of environmental pollutants, whether indoor or outdoor, can predispose and can have asthma. So there is this word is not right that it is born or made. Nobody can make somebody develop asthma, but if a person is susceptible, already susceptible with his family history, and he already has some kind of allergic tendency in his body, like eczema, which is a skin condition, skin allergy condition, and one condition called as allergic rhinitis, where a person will have sneezing, running nose. This also is a kind of a allergic condition. Such patients are more at chances of developing asthma.
Okay, sir. When does asthma starts?
So there is no particular age group where we can say asthma starts. So it can start very early in childhood in those who are born to asthmatic mothers, or it can start as young as when you're in 20s, 30s, or 40s. But one thing to keep in mind is those who already have history of asthma in the family, siblings, parents, grandparents, such patients will have the high tendency of developing asthma at very early age group.
Okay. My next question is, what are the different types of asthma?
There are many different types of asthma. We divide accordingly, like according to the level of control of the symptoms. We divide it as a well-controlled asthma, where the symptoms usually are well controlled. So hardly once in 6 months, patient have some minor cough and breathing difficulty. Second is a partially controlled asthma, where the frequency is little more. Third is an uncontrolled asthma, where the patients will have the symptoms of cough, breathing difficulty, and other things at least twice or thrice in a week. So this is according to the level of the control of symptoms. Coming to the severity of the symptoms, we divide it as a intermittent asthma, where the symptoms are happen on and off, weekly or fortnightly, or persistent asthma, where the patient have symptoms during the most days of the year. So this is the way we divide according to the severity of the symptoms. And coming to whether the patient is allergic or non-allergic, we can divide it as an atopic or non-atopic asthma. And we also divide asthma according to the cause. Like some patients work in some setting where there is a long-term exposure of the gases, fumes, some kind of dust and smoke. Such patients develop asthma. So we classify it as a occupational asthma. And some patients, they are completely fine. They'll be completely fine doing their household things, everything. But suddenly when they go for some kind of exercise, like treadmill test or anything aerobic exercise, they start developing asthma. Such asthma, we call it as exercise induced asthma. So there are many varieties how we can define and classify asthma accordingly, the level of control of symptoms, the severity of symptoms, whether it is allergic or non-allergic, or what is causing the asthma.
Okay. What type of asthma is severe?
See, like any asthma which is uncontrolled comes in the uncontrolled category, where the patient is not aware of the disease itself, not taking the proper treatment or not taking the treatment at all, despite being diagnosed as asthma, can have an exacerbation of severe asthma. But there is one particular asthma type I want to discuss. It is called as a status asthmaticus, where an uncontrolled type of asthma in which patient is not taking the treatment properly, or is not compliant with the medicines, or not taking the treatment at all, or taking the treatment despite, can land up with the varieties of a severe persistent type, can land up in a something called as a status asthmaticus, which is a severe form of asthmatic attack, where the patient will have a decrease in oxygen with or without CO2 retention in the body, requiring ICU admission with or without ventilator requirement in the ICU setup. So this type of asthma is usually very severe. If the attention is not given, medical help is not taken immediately or as soon as possible, respiratory failure, arrest and death can happen. So people have to be aware of the condition they are having, stick to the medicines what doctor has given, be compliant, be educated about your disease. So this is the thing we have to keep in the mind.
So, my next question is asthma a serious problem?
So it's a very good question actually. See, asthma, many people ignore if the patient just has a cough or very minor breathing difficulty now and then. I can say it's a manageable condition. But there are some terms and conditions, like if the patient has symptoms, lot of symptoms with a family history, and the patient is not compliant with the medicines or not taking the treatment properly or not taking the treatment at all, in such patients, high risk category patients, it can turn severe. So we can see that a minor condition or a moderate condition, if not addressed properly on a medical terms or not being followed up properly because of the lack of the awareness of the disease itself or because of so many other factors, it can turn fatal and serious. So it can become serious if not being focused appropriately.
Okay, sir.
Yeah.
My last question is, what is the best treatment for asthma?
Yeah, see, it's a very good question actually. There are many variety of the treatment for asthma. So we usually basically divide into two types of asthma medications. One is a reliever medications which take care of the acute attacks of asthma. Usually these are short acting beta 2 agonist which usually open the airways. So it also can include intravenous steroids. So in this condition, what happens? The symptoms usually, the treatment of the short-acting beta agonists lasts for just 4 to 6 hours, and they can be given in the form of nebulizations, oral tablets, or in the form of inhalers, which I had already discussed. The inhalers come in the form of meter dose inhalers or dry powder inhalers. Coming to the controller medications, these are very important part of the, it's a backbone of the asthma treatment, because this things the patient has to be taking on the daily basis. These medicines, what actually they do is they prevent the attacks of the asthma, and they help in maintaining the normal functioning of the lung. So controller medications, we have inhaled corticosteroids, long-acting beta agonists, and long-acting muscarinic antagonists, which come in the form of nebulizations. They also come in the form of dry powder inhalers or meter dose inhalers. So which I had told you earlier also. And there are some controller medications, added medicines, like we have methylxanthines, leukotriene antagonists, and mast cell stabilizers. These are some medicines which also add up as a controller medications in the treatment of asthma. So we also sometimes use a short dose of a low dose steroids if the patient has a severe persistent asthma, for sometimes at least 2 to 3 weeks if the patient has an exacerbation, and give it for at least some time until the symptoms are settled. So these come, these are the main treatment for the treatment of asthma.
Okay, sir.
Yeah.
So I have one more question
Yeah.
on behalf of our
Yeah.
viewers.
Yeah.
Is there any diet and also for this?
So see, this is a very good question. So as I told you, there are some triggers in the environment. Like if I explain, in the indoor air pollution, it can be a secondhand smoke, it can be a house dust, it can be dust mite, it can be your pet dander also, the dog or cat you play with. And coming to the outdoor pollution, it can be gas, fumes, and dust. So just like this, we have some kind of triggers in the food also, that which we do not know unless until we have that food and end up in having an asthmatic attack. It can be a simple broccoli, can be a simple tomato, cabbage, chicken, seafoods, milk items, yogurt, soya bean, it can be anything. So after eating certain kind of food, then only the patient realizes the patient will develop some kind of asthma symptoms. So exactly, I cannot say that a particular patient should avoid a particular type of food, but the patient will be aware that after eating certain kind of food, we'll take two patients. One patient eats the seafood and then suddenly he has a swelling of lip, breathing difficulty, wheezing, and cough. It means he is allergic to the seafood. He should avoid it in the future. Whereas one more patient has just a milk, maybe a buffalo milk or cow milk, he starts having the breathing difficulty, cough, and wheeze. So such patients should avoid the milk. Some patient can have an allergy with simple wheat, tomato. So to be preemptively to prevent all these things, what I can suggest is there are many antigen based tests, blood based tests, which identify for what all you have got allergy. So it is available in the Sakra. We call it as a comprehensive allergy panel. It's a blood based test. So around 50 to 60 antigens based test. So where we can identify preemptively that whether you are allergic to certain kind of food. So this is the way to tackle this problem.
Okay, sir. Okay. So any kind of exercises or like breathing exercise, would you suggest any?
See, breathing exercises might not help completely, but for the psychological benefit, but for the the compliance of the endurance of the lung mechanics, it might help. There are many breathing exercises like Anulom Vilom, Pranayama, Ramari, Sudarshan Kriya, breath in, breath out. You can still see in the YouTube. So to some amount they will help in the patients who are asthmatic. So to some amount they will help.
Okay, sir. Thank you so much,
Yeah.
sir.
Yeah.
With this, we come to an end of today's live show. Thank you, sir, for your valuable insights.
Thank you.
Thank you,
very much.
viewers, for joining us. If you have any queries, you can leave a comment and our expert will answer them for you. Thank you, sir.
Yeah, thank you. I'll be available in Sakra between 2 to 6 daily on a OPD basis. So for any of your complaints like this, you can consult me. Okay.
Okay,
She has already given the introduction, and Dr. Arjun Satapute, consultant in respiratory medicine. Be safe, wear mask, avoid the triggering factors, control the asthma, and win it.
Thank you, sir.
Yeah. Okay.